Joining me now is psychotherapist and author of Therapy Nation, Jonathan Alpert, alongside internist at Custom Care Medical, Dr. Frank Contessessa. Welcome to you both. Jonathan, Hayden started in the industry at a very young age and recently revealed a lot about the dark side of Hollywood that she experienced. What is that level of early exposure and adult pressure and responsibility? What does that do to a developing brain long term?
Yeah, no doubt. She certainly had her share of trials and tribulations, and she was very public with a lot of that. And we don't know exactly what led to her death or even what led to the addiction, but so many things can, including fame, early fame, and we've seen it play out with other childhood actors. Addiction certainly is a way that people may cope with the stress, the enormous stress of being famous and the actual act of acting early on. So it's a very sad situation, and unfortunately we do see this playing out across America every day, where people are dying of drug overdoses and addictions. And really what this shows is that addiction really is the great equalizer. It doesn't matter if you're rich and famous or an ordinary working American. It affects all of us.
Yeah, it absolutely does. Now, Dr. Contessessa, she spoke openly about dealing with severe postpartum depression, body dysmorphia, and alcoholism. Clinically, how difficult is it to treat addiction and deep-seated trauma when someone spends their pretty much entire life in the public eye?
David, it's very difficult, and I think that's why we see so many of these Hollywood stars and personalities fall into addiction, depression. It's a tough crucible that Hollywood is, and she spoke about this in her memoir. So it's extremely difficult to treat these real afflictions like postpartum depression and addiction in that setting. It's extremely difficult. Interestingly, we have to wait for the toxicology to come out. An autopsy was done, but it's going to take a couple of weeks to get the toxicology to confirm if this was an overdose or not. The 911 call references a possible overdose, but it's really not until the toxicology proves that it is. There are other things. Obviously, anytime a young person suddenly passes away, you think of some other event, either drug, cardiac, something along those lines.
Yeah. Now, in her final months, she exposed the dark side of the entertainment industry. Jonathan, from a psychiatric standpoint, is Hollywood structured in a way that pretty much actively just enables or even accelerates mental health crises for young performers?
Yeah, absolutely. And I see it in with other patients who have high-stress jobs, whether it's Wall Streeters or other people who run businesses. Stress certainly is a factor. Hollywood specifically, as the doctor alluded to, these people are in the public eye. They have to deal with just scrutiny constantly, and you're only as good as your most recent act. So there's enormous pressure, and people often will self-medicate, whether it's drugs or alcohol. So it might be time for Hollywood to take a look at what's going on and maybe offer more mental health services to people in the industry.
Yeah, that'd be incredible. Definitely, a lot of people need it, I'm sure. Dr. Contessessa, authorities have noted that no foul play is suspected, but an official cause of death, as you said, hasn't been released yet. What are medical examiners specifically looking for in a case like this? And as you said, it could take a couple weeks for the toxicology to come back. Why does it take so long?
To do these chemical analyses, and you want to get very specific on levels, it just takes a while to do those kinds of tests. When you do an autopsy, you're looking for gross abnormalities, trauma, fractured bones, things like that. You can find blood clots and pulmonary embolisms. Any really acute you can find. But it's going to take a little longer. Maybe she had an underlying cardiac issue. I was reading that her brother passed away young at 28 years old from an enlarged heart. So, and some causes of enlarged heart can be hereditary. She could have had, an aortic or mitral valve that was congenitally abnormal. That would cause an enlarged heart and a possible cause of sudden death. So we really don't know. It's all speculation at this point. But you're looking for any signs of trauma, any overt causes of death. You have to wait a while for the toxicology.
Yeah, well, we will be waiting because I think America wants to know. She was loved by many. I appreciated her work very much so. Jonathan Alpert and Dr. Frank Contessessa, God bless you guys. Thanks for joining the Pulse tonight.